What should someone do if, they received prolotherapy and it didn't work? Because sometimes someone will go to a prolotherapy doctor, they're a good candidate, and it just didn't work. So I'm just going to give you a few things of why it may not work. The most common thing that we see when we actually talk to athletes, and I see a lot of patients and athletes who've seen other prolotherapy doctors, and the most common reason they don't heal is they didn't get enough prolotherapy done to them. In other words, they didn't have enough solution injected into the area, or they didn't get enough injections. Let me just give you an idea. So there's people that will have an injury to the knee. They'll have an injury to the knee and they want to treat it naturally, so they go to see a prolotherapy doctor instead of getting surgery or an MRI. Well, some prolotherapy doctors will just do one injection into the joint. Well, if you have pain in your knee, it's doubtful the only injury is going to be inside the knee. Yeah, your MRI might find that you have an injury in the knee, like a meniscal tear, but think about it. If you had such a trauma or injury to your knee that it tore the meniscus, I'm telling you, you got knee joint instability. You may have, your anterior cruciate ligament may be lax, or your medial collateral, lateral collateral, but you need all these areas treated typically. So if you have knee joint instability and you went to a prolotherapy doctor and they just gave you 1 or 2 shots, I'm just telling you that's not the type of prolotherapy that I practice. I was trained by Dr. Hemwall, who learned prolotherapy from Dr. Hackett, who was the inventor of prolotherapy. He coined the term prolotherapy. Just as a reminder, prolotherapy means the rehabilitation of an incompetent structure such as a ligament or tendon by the induced proliferation of cells. Prolotherapy is only going to work if after the prolotherapy is done that the joint is stable. MRIs are notorious for being inaccurate. The accuracy, if you actually look at the accuracy of MRIs, it's anywhere from 50 to 65%. And that's not Dr. Hauser's opinion, that's the opinion of science. What it means is that MRIs are notorious for having a high false positive rate. That means that the MRI shows that you have a tendon torn, ligament torn, or meniscus torn, but when you go for your arthroscopy, it's not torn. Okay? So it has a high false positive rate, and it turns out the older you are, meaning if you're over the age of 60, or you're under the age of 20, the younger you are, the higher the false positive rate on MRI. So why is that? Old folks have meniscus degeneration, right? That might show a meniscus tear when all it is meniscus degeneration. So that gives a high false positive rate. In other words, the meniscus degeneration isn't doing anything. It's just something that normally happens with aging. So that's why the high false positive rate for older folks. Younger folks, especially 13-year-olds, 14-year-olds, 15-year-olds, your meniscus is still developing. It's still developing, right? You're going through puberty. So obviously the whole body's changing. So as your meniscus changes as you go through puberty, the MRI signal changes so that you get a lot of false positives. Like, in other words, you're concerned, your knee hurts, you do an MRI and it shows a meniscal tear, and then when the doctor goes in, there isn't even a meniscus tear because it's a false positive, which means the older you are, the younger you are, for sure get a second opinion, because probably it's a false result, so you need to go to a prolotherapist because you probably don't need surgery. Then MRIs are notorious for having a false negative rate. It means that the doctor examines somebody and it seems like something's torn, like just from a physical exam, like something's torn, a tendon's torn, ligaments torn, meniscus is torn. But MRIs are notorious for being false negative. It means that the MRI is saying that there's nothing torn when clearly there's something torn. Like you could just, jiggle the joint, it's moving all over the place. So the diagnostic accuracies, from my standpoint, it's not very good as far as MRIs. So I'm not a big proponent of MRIs. Dr. Hauser does order MRIs, but it's very, very rare. I think we got to get back to some low-tech kind of medicine, in the sense that what's hurting you, take a really good history, especially if it's an athlete. Where exactly does it hurt? do a physical exam. This is most likely what's wrong. If it's not a complete tear, you're a good candidate for prolotherapy. Then talk to the doctor like myself. How many visits do you think? How quickly can we do them to get me back in the game quicker? So we at Caring Medical sometimes will speed the process up and treat somebody every week to every 2 weeks. Especially if there's a big game coming up, or the season's starting, or there's a training camp that they have to get to. We've had anywhere from world champions here to Olympic athletes to pre-Olympic athletes to high school athletes wanting to get college scholarships to t-ball players to all the athletes. I understand being an athlete. I'm a 5-time Ironman competitor and have completed 5 Ironmans along with some ultra marathons and endurance swims, so I understand what it's like to be an athlete. The one thing an athlete doesn't want to do is do their athletics. So I can tell you definitively, as a patient of prolotherapy and as a doctor of prolotherapy, that prolotherapy can keep you in the game and get you in the game quicker. You want to get back to your sport quickly, the treatment that you need to get is prolotherapy.